Hi, I am the Charm City Maven, and this is the Charm Citizen Show. And we're going to welcome the guest for today, Jessica. Jessica, how are you?
I'm great. Thank you so much for having me. I'm really, really excited to be here today.
I'm excited to have you here today. Jessica, you are a therapist. I want to talk some therapy talk, but from
Okay.
the side, I don't have any problems to share. I talked to my therapist on Thursday, so you don't have to worry about me unpacking over
Okay.
here today. So tell me, what brought you into the world of therapy?
Well, first off, Miss Charm City Maven, I am a clinical social worker. And so for those
Jesus.
who don't know,
Hmm.
clinical social workers provide maybe about 70% of the outpatient mental health treatment in the United States and maybe
Hmm.
even the global world. We are the main providers of mental health services. So the way that I got into, be choosing to enter the therapy world because the social work world is so large and so many different choices of, things that you can go into. And so for the first 10 years of my career, I was really, really, really deep into medical social work, helping people with medical case management in hospitals, helping medical teams with the things that connect people to the community once they get out of the hospital. And so through that work, which also included hospice social work, where I provided intensive end of life care planning and end of life counseling, that's what kind of led me to say, you know what, I'm ready to take the plunge once, and become a clinical social worker and maybe even start my own practice.
I love that. Now, I just said it. I wasn't going to unpack on you, but I want to ask about the hospice care now that you mentioned it. My father passed away 2 years ago, and we had some engagement with hospice care and with the hospice worker, but I don't know that we actually utilized it, the service, to the best of our ability. So, what exactly does that entail? Or how do you wish people utilize the service?
Well, the thing is, and that's actually a really great question because in the Black community, I don't feel like we always talk about end of life care and the life planning, how, planning once you find out you have a terminal illness and things like that. So, with hospice, what happens is you generally get referred by a physician, right? When you reach a point in your care when you have a life limiting illness where they feel that there may no longer be curative options available.
Hmm.
And so hospice care is comfort care. It is care at home. Generally, it's provided at home
Yep. You get it
by a
at home.
family member, and the hospice organization will come in to visit the family a couple of times a week. It'll be a hospice nurse. It may be a hospice home care aide. I mean, a
Hmm.
hospice nurse, their role is to assess symptoms, so they'll come. And so that mainly includes like pain related symptoms, nausea, uh, maybe even sadness, depression, because that is normal when you're
Hmm.
talking about people on hospice have what's called anticipatory grief,
Hmm.
regarding your own demise. And so that is something that's really difficult to live with. And so hospice basically provides you a team approach in that way. So you have your hospice nurse who then plans your medications, who assesses your symptoms. If medications need to be increased, your hospice nurse will make a call to the hospice medical director to, increase meds and things like that, or just to report changes in condition. Hospice care aides come into the home maybe 2 or 3 times a week to provide personal care to the patient and the family, bathing, repositioning in a chair,
Hmm.
setting the patient up for the day, maybe even setting up their pill box, and just, helping with maybe light housekeeping. And it just really depends on the agency and what, they allow their hospice care aides to do.
Hmm.
And then you have a hospice chaplain who that is a service that you can reach out to your hospice organization regarding, and they of course provide spiritual care. And it's
Hmm.
from the perspective, again, all of this is from the perspective of the NHPCO, which is the National Hospice and Palliative Care Organization. Hospice care is end of life care. Palliative care, which is a word that sometimes is interchangeably used with hospice, but it's
Hmm.
not necessarily hospice. Palliative care is also pain and symptom management, but a person can receive palliative care and still maybe eventually pursue more curative treatment. Palliative care does not necessarily mean end of life care, but hospice care is end of life care. And then you
Gotcha.
have a social worker who works with you. My role was I was the first person you see when you get to the house. I did all of the consent forms. I explained the insurance process, which is Medicare is the main provider of hospice care services. And
Mhm.
it's kind of like a bundle package when you sign up for the Medicare hospice benefit. Everything that I just told you that you get with hospice is paid for through the Medicare hospice benefit, and you
Right.
don't pay co-pays. A lot of times, the hospice provides the medication. They provide personal care supplies like maybe chucks for the bed, maybe personal care stuff. And all of
Mhm.
this is billed under the Medicare hospice benefit.
The
If this
hospital
is a
bed.
yeah, hospital bed, commode, it really depends on the organization on what they all include. Hospice is also paid for by medical assistance, all categories of medical assistance, and all categories of private insurance. It is hospice organizations that provide charity care. So when I worked for hospice, I worked for a nonprofit hospice that actually no longer exists. It's called the Joseph Ritchie Hospice. And we
Okay.
did a lot of charity because we were actually founded by a charitable organization. And shortly before, I did hospice for 5 years. And the reason I left is because we had ended up getting bought out by Gilchrist Hospice, which is now one of the bigger
Larger ones, yeah.
hospices in the Baltimore area. Yeah, so
Yeah.
like that's what hospice does. The social worker, we come in, we assist family with finding resources, whether I help people make funeral arrangements. I would learn about the different types of funeral resources that we have in terms of vouchers, things to help people pay. And also a big thing to mention about hospice is that it's an all ages type of situation. So it's from 0 to
Unfortunately.
80, 0 to 100. So when I was doing hospice, unfortunately, I also did pediatric hospice. So I
Mhm.
did it with babies. I did kids. Over my 5 years of hospice, I'm going to say I did about 600 deaths.
Oh.
Yeah,
Oh,
and I
wow.
also was in charge of the bereavement program afterwards
Mhm.
because another part of the Medicare hospice benefit is hospice is supposed to provide you with 13 months of bereavement support. So I would do the groups
Who knew?
for huh?
I said, "Who
Man, I'm
knew?"
not
I
sure.
like I
Well,
told
I'm
you.
not sure if that's still law, but back
Yeah.
I've been gone since 2014.
Right. Okay.
So I was there from 2009 to 2014. During my years in hospice, I was heavy into grief and bereavement help. So I was doing the groups that we provided, and I would do a lot of trainings with Roberta's House,
Mhm.
which was just coming about back then. And they were
And
doing a
Roberta's
lot of
house, I'm sorry, what Roberta's house helps families, correct? Is it
yes,
primarily
it's
women?
grief and loss. It's grief
Okay.
and loss. It's
Okay.
grief and loss. It's the same. It's basically a grief and loss support center.
Mhm.
And so when they have this wonderful training, it's a 3-day volunteer training that teaches you about the task of grief and kind of merging the clinical with the cultural aspects of like the Black experience dealing with
Mhm.
grief with Black folks. And so, and I give all credit to Annette March Greer for like putting that together. And like I was like chatting with her and like going over there when they first started and to see what they've been able to do now is incredible. Because the
Mhm.
vision was to support Black folks, dealing with grief because our grief is so many different cultural nuances to it that people don't always understand. And that was one of the things that I loved about working in hospice. We were not a Black organization. I was the only Black professional on the staff
Mhm.
outside of the medical director, but most of our patients were Black. And so some of the things like that, some of my colleagues might not have seen a lot of is like, people fall out, but they're not going to die. You know what I mean? Like
Yeah.
you just tell somebody like, you confirming that death occurred. And so, Black people, we mourn. We have a very active mourning thing, but it don't mean we need to go to Shepherd Pratt, because mama's screaming, people
Yeah.
falling out, people screaming, like they gonna be fine. They gonna be fine. That's what they need to do. And so that's kind of what got me into being a therapist. Like all of my years doing hospice, people talking to me about their real fears about
Mhm.
dying. I will always say, well, I ain't never died before, so I can't tell you what it's like. I'm like, but I have known a lot of people that died and I seen it when it happened. So this is what, this is what I saw, or this
Mhm.
is what they told me. And so it just became a thing where I loved it. I loved it. I really did love that job.
Thank you so much for sharing that. So like I said, I've only experienced one significant death, which is the death of my father. And we went through a long process of anticipatory grief because he was ill for quite a while, almost a full year before he ultimately passed. In fact, one of my reflections before was it was 9 months, and a part of the preparation, the only preparation that I knew to consider it similar to was like my own pregnancy and like preparing for birth is similar to preparing for death. But I will say, I watched a show not too long ago. Starred Williams, the white Michelle Williams,
Hmm.
and she had cancer. It was terminal, and she had to go into hospice care. And the whole show was about like, okay, how are they actually going to deal with her ultimate? Well, how was she going to deal with dying, and her mother and her best friend who wound up being her caretaker? But in it, it really did a great job of showing all of the different care providers and actually talking about it. And I felt like this makes it less scary. This makes you accept it like that much more when you actually do have a credible team who can really just sit and talk with you and explain all of the processes, the emotional processes that you will personally go through, the ones that they will go through, but then, like you said, like all of the other physical components of it as well. So
Yes.
that is a great service.
Yeah, we used to have one of my favorite things about working for the organization I worked for. We had a book. It was called "How Do You Know the Way," and
Hmm.
that's what we would give to families when patients would start taking a turn. Because I was a home hospice social worker, so I was one of those people who saw people go from walking, talking, just coming home, just starting hospice to to they bed bound, they are not speaking, things like that. And so the "How Can You Know the Way" book will help families with recognizing the physical symptoms of death.
Yeah.
And so I really loved that job because it taught me about being present for people, especially, I mean, that's the most vulnerable time in a person's life.
Yeah.
And like I would have people literally like lay on top of on my shoulder and just like saw men, women, elderly, young, and it just really made me see the world in a different way. And I still think about all of my patients, all of them. Like,
Oh.
cause I'll be at the store and I see a person, family member, and they'll be like, Jess. And I'll be like, say your name again. And they be like, you was working with my brother. I'm like, oh, okay.
Mhm.
No. But yeah, so I really loved it. So that's kind of what led me to, eventually becoming just like a therapist, just regularly.
Right.
Once I
Yeah.
got my clinical license.
Got you. And how long is that whole process?
So that was so I got my MSW in 2009 from Howard University. And
Mhm.
what's even more funny is like when you're in graduate school for social work, I went to Howard, so I was commuting back and forth. But I asked them if I could do my field placement, which is it's a graded internship that you have to have all of the hours to be able to earn this degree. It's something that is ruled, by the Council of Social Work Education. So Howard blessed me by allowing me to do my field placement for my second year at the VA hospital here in Baltimore. And while I was in work, my two units were oncology and infectious disease.
Okay.
And that's how I first started learning about and people die a lot from HIV and cancer. And so I was doing a lot of hospice referrals. And that's what the hospital I was making referrals to was the one I ended up getting a job at. The
Okay.
social worker who I was making referrals to, she was like, "Do you know that I'm retiring June the 1st?" I was like, "No, you must be retiring." And she was like, "Yeah." She's like, "You should apply for my job."
Oh, okay.
Yeah,
So just like
she was
that.
like,
Yeah.
and
Right.
mind you, I had never seen this lady.
Uh-huh.
This was like in 2008, 2009. We was just doing typing and talking on the phone, faxing. And this is a older white lady. And she's
Mhm.
like, Jessica, I think you would be good for my job. And I
Oh.
applied and they interviewed me and they
Mhm.
told me they would pay for all of my clinical supervision. She's the one after she retired, she came weekly and gave me supervision. And so I got all of my work hours, all of my supervision hours, everything in
Mhm.
that first job that I got out of graduate school in hospice.
That's perfect. And she was committed to making sure that got your wings up
Yeah,
under you even within it. So,
yeah, she was getting paid. So I mean, you get paid
oh.
for providing supervision. Yeah, and so her and I had a pretty cool relationship. So
Mhm.
yeah, so they one thing I will say they looked out for me.
Okay.
I was kind of like I was not unused to being the only Black person on the team because of choosing to go into medical social work, which does not necessarily always have a lot of Black social workers in it, especially when I started. It was
Right.
not super diverse, but it ended up being the best thing for me. And when I left Richie, I had the Board of Social Work Education examiners had approved my LCSWC application, and I went into medical social work in a hospital setting.
Okay. Now, I do remember you saying that in terms of people who go into the field, it's not a lot of Black people, a lot of Black women. Is that correct?
No, it's a lot of Black women in social work. It just depends on what area you go into. So when you
Okay.
go into an MSW program, you can pick a concentration. So my
Hmm.
concentration was medical social work from the beginning. Now, when I got to Howard, I knew that's what I wanted to do. It was only 3 other people in medical social work. Most
Okay.
people are in the mental health concentration and children and families. And that's in general in social work programs. Like they
Hmm.
have most people in the mental health focus and the children and families. But regardless of what concentration you choose, if you're under a direct practice constant curriculum, you'll be eligible to sit for your social work, LCSW exam, your LMSW. But for me, I really wanted to go into the medical field. And so my medical social work professor was on the board of directors for a large medical institution
Hmm.
in Washington, D.C. And she was a politician. She was basically everything that I want to be, basically.
Okay.
Yeah, like she was a woman of color.
Hmm.
And it was me and it was 2 other social workers, and we all 3 knew that that's what we wanted to do. And what's so funny is one of my colleagues that I was in class with, she still works at the job that she did her field placement at in 2008, 2009.
So she
I
loves it
talked
that
to
much.
her and she's moved up. I just
Hmm.
literally just talked. She went to Howard too. I just talked to her a few weeks ago.
Hmm.
Yeah,
Yeah.
she's still that's like it's yeah, so that's what so it's a lot of Black women in it. I think that the rub could be with the license classifications.
Okay.
And it's a lot of different schools of thought regarding, the gaps in people passing the LCSWC exam, which
Hmm.
is a big broad conversation in the social work world across the country.
Hmm.
It's conversations around bias in the exam and in the questions. It's questions around equity and the development of the questions. It's questions around equity and the quality of social work education that is provided across institutions across the nation.
Hmm.
And looking at what programs are people graduating for and from, and if those programs are preparing them to sit for the exam. So that is where the conversations about Black people in social work come up a lot, about
Yeah.
the presence of Black LCSWCs, which is the independent license for social workers, and what a lot of people, ultimate goal is. Like that's
Hmm.
what you want to do. I mean,
Right.
if that's if you want to be a therapist, you have to be a LCSWC.
Got it. Yeah. And there's a lot of stigma, I guess, with the word social worker in the Black community. Would you say like that still is a thing?
Well, yeah, because honestly, I think that and I'm saying this as you know me,
Hmm.
you know me. I'm not that girl. Social work. I think the rub is people will like do work, like case work type of work,
Hmm.
and like just like assisting type of work, and they will call that social work. And I think that, for professional social workers, that is a challenge for us because it takes a lot to become a professional social worker, and
Hmm.
anyone cannot just call themselves a social worker. By law, a licensed social worker is a person who not only holds the degree but also holds the license.
Right.
You know what I
Right.
mean? So the license, I mean, the degree by itself does not give you the title of a social worker.
Hmm.
The degree and then the license gives you the title of a social worker.
Got it. Got it. That
Yeah.
almost
So like,
sounds like the rub that gets not Jamal Bryant, Dr. Umar. Like there's some division. I know that he's the therapist, but there's some division about whether he's licensed or not, and it winds up
well,
being like a
yeah.
hubbub.
See, I don't know a lot about him. I know he's not in the social work field.
Hmm.
Um, I know, so I can't really speak to exactly what his whole deal is. But yeah, in the social work field, especially for me, I'm not a person who like talks about that a lot, but because of everything that it takes to get to like the place where I am in my career. I'm 43. I have been working on this since 2000. I mean, like, I've taken
25
no breaks.
years.
I went, yes, and it took me, I've had 3 kids. I've been married. I've been divorced.
Mhm,
I've had jobs. I've had this, and it has taken me a lot to earn my credentials. So I understand why a lot of my colleagues have an issue when
mhm,
someone who hasn't, done the same things that we've done to earn these credentials, when they don't have it, but they give themselves that title. And then it's the
right.
expectations that come along with it. A licensed certified social worker clinical can diagnose you with a mental health diagnosis. Like it's a lot of different things that we're able to do. It's a lot of different forms we're able to sign off on. And I think
Mhm,
when people tell people they're a social worker without, you know, having all of that, like that can make a person think that you're able to do things that you're not able to do.
right.
You know what
Yeah,
I mean? Similar to I don't know anything that is similar to because I don't know that much about the inner workings of a lot of other professions.
I got you. I got you. Mental health is a big thing. I think especially now, a lot of people are talking about it.
Okay, yeah. So I'm not a generalist. So I'm a specialist. Like, so I work with women, specifically women,
Mhm,
dealing with depression and life transition, through parenthood. If someone feels that that is something that they may be dealing with, I'm a person who refers out for that
mhm,
because that's not in my wheelhouse. And I feel you need like certain evaluations from a certain level of a professional. I
yeah,
generally refer to a psychologist or a psychiatric nurse practitioner when it comes to that the ADD and the AD.
mhm.
I generally refer people to those professionals when they have those questions.
Are you noticing any trends where people are coming to you with that diagnosis? Like they already have it?
Not really. No,
Okay.
I don't, not really. So I try to have a really tight admissions slash intake process
Mhm,
so that people understand what Restoring Destiny does and who we specialize in seeing and who we don't. Because everybody is not our client. And it's okay. That's okay.
mhm.
We do what we do well and what we don't do well and what we don't specialize in, we don't do.
And why I mean, I think it's kinda obvious as Black women because 'cause you're a Black woman, but why Black women? Why Black women only?
Well, it's not Black women only. It's all women.
Oh, okay.
For the most part, Black women reach out to me, but it's all
Mhm,
women. But my niche, my niche population is Black women because of the different mental health issues that we face, and also because of the difficulties that come along with our experience, like in this country and in the global world,
mm,
and how that impacts us on a day to day basis, economically, politically, emotionally, how we raise our children. I believe that that is just a place where Restoring Destiny shines. And
yeah.
not just because I'm a Black woman, but just because of my own clinical expertise and the training that I continue to engage in. Like I'm taking trainings like once a month. Like
Oh, wow,
I
okay.
mean, for social workers, we do have to maintain 40 credits, but because of the different things that I'm seeing, like, so I'm seeing a lot more, a lot of trauma, a lot of
Mhm,
DV,
mhm,
a lot of single parenthood,
mhm,
a lot of death, people who lost their children, other parent, things like that, things like that. And a lot of Generation Z specific issues. They don't want, like,
Sad
that is
issues.
my base. Like, just all of the different things, like they're coming of age in an incredibly difficult time. Rents is
Yeah.
like, for a 1 bedroom apartment, it's like $1,200.
Mhm,
When my first house, it was a 2-story house, it was 750. It's kids now 25 years old. They gotta work all day and all night to be able to afford their car note, their apartment, and everything. So it's
mhm,
a lot of different. So yeah, so my sweet spot, like my main the people that I get the most referrals from is like people born between like 95 and 2001. Like right now, like
mhm.
they really reach out. It's like they want that. They want that.
They
They
need
need
it.
that. They need a safe space, especially because I'm a little bit older than them.
Mhm.
And they can, they feel like they can trust me. They know that I'm not going to judge them. I try to, even in the most, situations where a person may think that things I'm
They
sorry, that
need
was
you.
another call.
So I know they need.
even when things have gotten totally out of control, they know
Mhm,
that like it's nothing that will make Miss Jess look at them like they could say that they just was in jail for a week. I'm not, it's no judgment
mhm,
here, you know. And so being that safe space for them to be able to talk about their challenges and listening and not telling them like, well, this is what you should do and this
mhm.
is what the answer is,
Right.
you know.
Yeah. Yeah, I think even myself, I've experienced like a lot. If therapy is such a safe space, because in a lot of places you receive like a lot of judgment of like, well, this is what you should have done. Well, if that's what over the bridge now. It's not what I should have done.
Yes.
It's like, what can I do now? Even today, I told you that I cracked the front of my screen. My sister was like, "Well, did you have a screen protector?" Well, it's now broken. It wasn't protected.
Right.
That whether I had
Yeah,
it or
like
not.
why bring it up now?
Right.
Yeah. Yeah. So that's me as a therapist. Yeah. So it's like sometimes my patients are so surprised. Like they'll be like, "You not going, you going to hear what I'm gonna have to say. You going to judge me?" And then they'll tell me the whole story, and then I'm like, and they be like, you so like you see what happened?" I'm like, "Yeah." I'm like, "It's okay."
Mhm.
You know, and I can say that as you know, putting on my outsider therapist hat. You know, in my 20s, I was crazy as I don't know what. I was doing all kinds of stuff. So I'm able to, you know, understand when you're young, you make mistakes. And
Mhm.
like nothing is unfixable.
Right.
Everything, as long as you're alive and the world is still going, we can fix it. Or we can't fix it, I can help you deal with it. I'll be
Yeah.
here with you while you gotta deal with it.
Yeah. That's great. So you are 43, so you're in your 40s. Crazy in your 20s, you said. What do you feel the additional wisdom of your 40s? Like, did that come upon you? I felt like it came upon me. I mean, I just got here.
Yeah, I feel like, I mean, along with like I had all three of my kids in my 20s. I got married in
Mhm,
my 20s. I got divorced in my 20s. I did a lot of things that are like I was one of those people who just wanted to like take control of my life at a very young age. And
mhm,
so yeah, so I did a lot of things, but I also made a lot of mistakes. And so that's one of the reasons I think that I'm able to be a safe space for my clients because I've made a lot of big mistakes in my life too. You know, good thing they
mhm.
ain't taking me down, but
Right.
I'm not a person that's out here perfect, you know? So yeah, so like I feel like my wisdom, it really was coming in my late 30s. My father died when I was 36.
Mhm.
And like I became a grandmother at like 41 and like different things that I've experienced
How is
has
that?
helped me being a grandmother
Yeah. Do you think is
or
there a difference between being a grandmother and a mother? Like, does it feel differently to you? I guess is my question.
mm,
Motherhood
and
versus grandmotherhood.
it's kind of like being a super mother if you ask me
A
because
super mother. I gotta write that down.
you feel responsible for your child and your grandchild. Well, that's me, but that's the kind of
Yeah.
person that I am.
Mhm.
So it is a great feeling. My granddaughter Jalen was born when my daughter Serenity was 17. Serenity's teenage years were cray cray. Serenity is a Cancer and she's a great girl. She just wants to she wants to have fun all the time. She's
Mhm.
like the party. She's lit. She's young and turning.
Mhm.
And she had my granddaughter like shortly before she turned 8. I think that having Jalen in our lives has made all of us really happy.
Mhm.
The difficulties of my daughter teenage years weighed heavy on myself and her father.
Mhm.
And so becoming grandparents just has really just been a great experience for us.
Mhm.
Well, especially for me, I really love supporting my daughter. I love seeing my daughter's gonna be 21 next year. I
Yeah.
like seeing her mature. I love seeing my granddaughter grow. And it just makes me hold myself accountable more. Once I became a grandmother, I already was like a person who was focused on my career and like ambitious. But once I became a grandmother, it just took it to 1,000.
Okay. Manageable, but to
Yeah.
1,000.
Yeah, it's like something that like I'm a person that's like those football coaches that wake up in the morning and they like, let's go, let's go. That's me. That's me. So like
Okay.
I'm a lie. I'm intense.
Yeah. Alright.
So once I became a grandmother, that just added to it. I was already like that, being a
Yeah.
divorced mother of three. So adding my granddaughter, it just made me be like,
Yeah. I
so I love it.
You having those experiences, I bet that it does help people deal with, like, their own stigmas. Like, for example, I have learned that I have had to deal with my own stigma of being a single mother. I've never been married. Stopped being with my children's father 8 years ago now. But like
Mm.
just the weight of the idea of you're this essentially the boogeyman of the Black community is always seen as the single mother. And like that stigma can weigh on you. It's such a funny thing because it's like I pride myself on my motherhood, but this concept of something that I'm supposed to be, which is perceived as negative. It's like how do you even get away from that? Because it's like not that it's a bad thing, but we have taken it as it's supposed to be a bad thing, even though it's something that's fairly common.
Right. I mean, that has been like like that's been like a really big challenge for me as well.
Hmm.
When my at the time when my husband and I started having difficulties, all I was thinking is, "Oh my god, I do not want to get divorced. I got 3 kids. Like I'm gonna be by
Hmm.
myself with 3 kids. What the hell am I gonna do?" And people
Hmm.
are gonna talk about me. They wanna say she's a single mother. She's a single mother.
Hmm.
But then I just ended up being like, honestly, that's their problem, not mine, because these are my kids and I love my kids. They the best
Hmm.
thing that ever happened to me. I'm never gonna apologize, and if you got a problem, then that's on you. It's
Right.
not a me problem. And so when it comes to I talk about that with my clients a lot. I have a lot of clients fighting with the stigma of being a single mother.
Hmm.
And it's really hard because social media, even the things you see on social media, people wake up in the morning talking about single mothers. You like, dang, I ain't
Dang.
even drink my coffee yet. You talking about us.
Hmm.
But I think that it's a sense of pride for me. Like getting divorced was really hard. Like my ex-husband had a really good job, and I thought we were going to be that family. I did. I met him in college. We both graduated. I thought everything was going to be everything, and it was not how it worked out for me. And for a long time, I was devastated by that.
Hmm.
Devastated. It was so hard. And sometimes it still is. When my children were younger and being that super mom that we are, and we're here and
Hmm.
we're there in different circles that we run in different places where we go, there are a lot of married couples, there are a lot of married families, and sometimes it can be different. The first 5 years of my divorce, it was like a knife. It was like a
Yeah.
knife.
Yeah.
It was like a knife. But now it's like that crown for me. Like
Mhm,
I'm like mother, and I
mhm,
did it on my own. Like, so I feel so good because it's like my youngest just turned 15. We've been divorced since he was 2, and it was hard, but it's something that I'm so very much like proud of in
yeah,
myself. It has built so much confidence, just showing myself like that I can do things like just even something as small as behind a Christmas tree. The first time I took my children on vacation by myself.
yeah,
Or I have a daughter in college right now, my second daughter, and like I'm paying tuition. And like
mhm.
I just feel so proud. Like when I made
That's
my
wait a minute,
last
what?
payment,
Yeah, that's significant. I mean, all of it's significant, but that's significant in this day and age.
yeah, paying tuition. So like college is like a lot, but make a long story short, like my daughter didn't get everything funded like I thought that she would, but I kind of like the research that I was doing. A lot of parents were saying like you're not probably gonna get everything covered, so
Mhm,
just be prepared to have to make a payment plan or whatever. And I stood on business because I really did not. I wanted my second daughter graduated from city. She's that type A girl that
mhm.
plays sports. She does all of the things. Every child is different. You got to parent them different. That is the
Right.
one. She wanted to go to Norfolk State, and that was that.
Okay.
So
She's
I
the
was
same.
like, I'm going to make that happen for you.
Is that a HBCU as well?
And that's just a HBCU. I mean,
Mhm,
lovely. It's a lovely campus. I really am so happy with her being down there. Oh my goodness. It's I just feel so proud. It makes like when I was moving her down, what's funny, it was all of these single moms.
mhm,
Our
mhm.
age generation. We all had the same like little purple bags. We was all had on that little t-shirt. And
Yeah.
we like, hey girl, you bringing your daughter? Hey girl. And it was just like we was also proud of ourselves, like that we made
Right.
this happen.
Yeah.
So yeah.
I'm not too far behind you. I mean, my daughter, she is a freshman at Western, but already I see that
Mhm.
we get in the postcards in the mail for college, which I like. I'm ready for that part of our lives. I'm not rushing it because I want to enjoy her high school experience. But yeah, college is right around the corner. My goodness.
Yes, and basically you might as well say you really only have ninth to 11th grade, because as soon as 12th grade starts, you start doing college applications because you want to do early decision or whatever.
Yep, I do.
Yeah, and then you start like, well, junior year is just if your child has certain plans, junior year is just so
Mhm.
that is the big time. So ninth and 10th
Right.
grade is the building blocks. 11th grade, I sent Sydney on an HBCU tour. It was 14 HBCUs.
Mhm.
Um, and she loved it. And she
Okay.
went to Howard, Bellman, Clark, everything. She came home like, Mom, I'm going to Norfolk State. It's like, you went to all of those schools and you going to Norfolk State? And she was like, yeah. So I was like, well, I guess you're going to Norfolk State.
She made an informed decision.
Yes. And like,
So,
so I'm not gonna lie, at first I didn't know too much about it. I didn't know too much about
mm,
Norfolk. So after she got in, they sent this little paper about admitted students day. Guess what?
mhm,
I rented a car because I don't
mhm,
drive. I have a license, but
mhm,
I don't drive. I rented a vehicle, rented a van. Her father drove us down there so we could go see the
mhm.
campus because I was like, I gotta see this campus before I make a
Yeah,
decision. And I
right.
walked around and we loved it, and that was that. I think that I guess my point is to say, like, single mothers, we capable of doing that. We capable. We got this. We got
Yeah,
this. We
yeah,
got it.
we have been.
We
So,
got it. We out here
right.
handling our business.
We
And
definitely.
if you're in a situation that's coming unglued, especially today, because like when I was getting divorced, our situation was becoming unglued, and we had a lot of like issues with arguing and different things like that. I thank God that I left when I did, because
Mhm.
these days you see so many women end up being killed in the midst of
Yeah.
disagreements about money, about custody, about child support, about all these different things. And so I guess my point is, when you see stuff getting bad,
Mhm.
even if you're worried about what other people want to say, you gotta get away from there. You gotta get those kids away from that situation, because
How
kids aren't always kids.
Yeah. What, you said as things become to get unglued, are there certain hallmarks that you think that people should pay attention to when they're trying to make that decision? Because oftentimes people are on the fence about, disconnecting.
Yeah. I feel like if you're experiencing like one thing, like the constant walking around on eggshells for
Mhm.
yourself and the children, and if you're dealing with a person who's dealing with a lot of rage, financial issues, different things like that, I think that well, you need to know when danger, the danger sign is showing. For me,
Mhm.
like it was I guess it was the worst thing that I experienced, and the reason why I decided to become a single mom. We had an issue with infidelity, which I was willing to forgive that because we had 3 kids.
Mhm.
But what I ended up having to leave for is because during the time of his affair, he stopped paying our mortgage. And so one day, me and the kids were leaving out to go somewhere, and they had put this note on our door. And so I was like, hell no.
Oh,
They
Lord.
ain't putting me and my kids out. And that's when I was like, I'm moving. I did not know how I was going to move. I
Mhm.
sold everything. What I did was I gave myself 30 days. I sold everything that me and the kids couldn't fit, everything
Mhm.
that I loved, but I needed to get rid of so I could pay for a deposit on an apartment. And that's how we were living in Randallstown.
Mhm.
I was so desperate. I moved into these terrible apartments down here in Emerson Village when we first broke up, but I had nowhere else to go. I had nowhere to
Yeah.
go. And my apartment was $750 a month.
Mhm.
And me and my son was sharing a room. My daughters shared their room. They started going to Thomas Jefferson. We started
Mhm.
being a part of the Baltimore moms with Dominique and Mocha
Yeah.
moms. And we were just doing things. And I just rebuilt my life.
Yeah.
I mean, that's literally, I came back to the city in 2013.
Yeah.
And yeah, I was just
And
like,
that's what you're gonna
and
do.
yes, yes. And people just, because when we first got divorced, when we first were separating, my husband was like, why would you, when they get a divorce, you got 3 kids, you're gonna be by yourself? Okay. I'm going to sit
Right.
here and wait till we get put out, or you do something else dumb.
Right.
No thanks.
Yeah.
So I'm just saying, for that woman who's like, well, he's my children's, because I used to be that woman. That's my husband. That's my children's father. This, and
I
that.
was
Like
that woman.
if yes, and the kids are not your children grow up. I keep on saying I have a
Mhm.
20-year-old. And
Mhm.
like the 20-year-old, the 18-year-old, the 15-year-old, they have memory. I mean, kids have memories. And so that's why I'm so glad I did what I did when I did. So
Yeah.
that's my word of advice to a mom who is not sure. Everybody in the house is scared all the time. And when dad come in the house, if the dishes ain't washed or if this is that, dad gonna start
Mhm.
crashing out.
Yeah.
I mean, that was just a situation that we had to deal with, and I was just like, and I'm from Lexington Terrace, and I had never been through nothing like that. Like I
Mhm.
had never seen nothing like that or nothing. It had me shook. So
Yeah, people change. I think that's the part that people don't realize is that people can change and sometimes it's for the worse. And you have to make decisions that are best for you. Not even so much the kids. It's like the kids, of course, but I think a lot of the dilemma is that a lot of people don't recognize that you yourself are a person that is worthy of saving and being happy and healthy and whole.
yes,
So, like, that was the main thing for me. Ultimately, it's my own peace of mind that Imma make sure that I have regardless. Like, no job, no man, no
right, right.
situation is gonna have me messed up. I can't do it. I'm quick to be
Right,
like,
and if you don't have any peace, your kids won't have it. So that's the
"No."
thing, like, if you're scared and it's gonna affect the kids, and so, my children had been was were like a big choice for me and why I did that. And they also were a big reason why when I got divorced, I was like, at first I was like, oh, maybe I should get married again before they grow up and this and
Mhm,
that. But I was just so like I knew that they were gonna go to college and they were gonna have to do this. So that was why I just been so focused on my career.
mhm,
And so now they're getting older, and I'm like, is that something? Because now I'm dealing with that thing as a Black woman who has focused on my career and did all of the things. It's like, who
mhm.
even would I date now? So that's a whole different conversation. Like
That's a
Black
different
women, we
one.
have so many different things that we deal with. But putting yourself and your children first is definitely the most important. And your money, children, money, yourself.
Right. Yeah, that's true. That's true. And you know what? I think about this often. I mean, now that I'm in my 40s, never married, I also think about I still also have a lot of life. I got a couple decades on me, like knock on wood. So I think
Yes.
even the pressures or the concerns that we have in this decade is not going to be the same in our 50s and 60s. And we still might have 20
Yeah.
years ahead of us that include love. At least that's my hope. So,
Yeah.
'cause at that
Yeah.
but by
It's
that time,
yeah.
we all have, older kids, and we're all just hopefully at least I like to think of, like, that will be my 3rd act, and who knows what type of life I'll be living then. I don't even know if I will be living the same type of life, or even if I want to. Like, life is for living. I
Yes.
wanna live.
Yes. Yeah, my third act, I wanna be like I really want to be a woman leader, like a super duper woman
Mhm.
leader in business. And so
Okay.
that's one of the reasons why I say I don't know. Cause like I know for a fact what I want to do for my career, like all the way until I'm like 80.
Yeah.
But so like that's what I'm like, and because that's what makes me happy. I mean, unless I met someone that it was like, boy, you knocked me off my feet, you know. You know what I mean? Like, and
It's
that's what I
possible.
do have. That's my prayer. Oh
Mhm.
yeah, I have a prayer, and I'm prepared, but
Mhm.
I'm not banking on that. Like, I got a lot of things in my life that make me happy and that bring me joy, and like waiting for love. Like, sometimes I did have that challenge at one point when the first couple of years of my divorce. It's like, I'm only 32. I'm only 33,
Mhm.
and you think that you can meet somebody and all of these things. And so at 43, I'm just like, if I do, I do. If I don't, I don't. I'm still all that. I made
Yeah.
myself.
Yeah. Yes, yes, you did. Talk to me. So, I mean, of course, I know you from being out in the community. You and I are on boards together. What does that mean to you, like as a part of your life, the community aspect?
I really love, well, first of all, being from Baltimore and for me, the community aspect is really important because, especially when it comes to presence and like boardrooms and organizational leadership and things like that, that's really important to me because of where I come from in Baltimore.
Hmm.
And because of a lot of the experiences that I've had on my journey to becoming. And so I try to always be present in certain spaces because a lot of people from places where I'm from, people they're invisible. Their
Hmm.
perspective might be invisible. And so I make sure that I'm there
Hmm.
solely because of that. You know what I mean? Like I'll be the one I love the woman that I am and everything that I've done, but just being that representation of poor Black Baltimore, not like Baltimore where people go to college and we're
Hmm.
talking about boards and we're talking about summer camps and
Regular
like I'm
people.
from Lexington. Yeah, I mean, and for me, I wouldn't even say regular because like I'm from the trenches. I'm from like the gutter. Like I
Hmm.
literally grew up right behind Lexington Stars projects. So during my experience of life, I've gone through so many experiences where people have acted like I was nothing, lower
Hmm.
than nothing.
Mhm.
my perspective wasn't valuable. And part of that is because, I mean, you and I have spent time together, so you know, like, I am kind of introverted in some points, and I'm not always quick to put stuff, out there about my thoughts or whatever. I'm more of an observer, and so sometimes it's difficult for people to understand that, and so they might think of observation as lack of knowledge.
Mhm.
And
Mhm.
so as the years have gone by, I've made it my point to be present in places and to add research to things and just to represent for the trenches. Cause like the trenches we in here, period.
Definitely
Yeah.
here.
We
Definitely
definitely
here.
here. I grew up in a time like I grew up where I had friends who parents were on drugs, like that Baltimore story, that the wire, the corner,
Mhm.
all of that. And so like that's really what I came from. And so that's why it's important for me to be present here to show the kids that you see on the corner with they might got two ponytails and might be dingy. You won't see them again. You
Mhm.
won't see them
Going
again.
on up.
So watch who you overlook. You'll see them again. That's
Right.
when my grandmother would say, that's going to come up on a test, right? And so that's why I make sure that I'm present in spaces and that I also always provide my analysis,
Mhm.
on things that is not just based on anecdotal information, but based on many years of rigorous study, in addition to my lived experience. And so that's why it's important for me to be in the community, really.
Yeah. And you have a
Socially,
big
it's important for me as well.
that's socially, I think it's a big component. I don't think that enough people like, I don't wanna downplay that part because society is built on people and the interconnections that we have, and so all you're sharing is that, the people who other might otherwise be seen as undesirable do deserve to be seen as well, and I think that and build
Exactly.
community with them, so I think that is great.
Exactly. That look when and I say this to anyone that I do work with, that
Mhm.
like that's my whole vibe. Like I've known some of the most brilliant individuals like in
Mhm.
like the world in Baltimore, like in the
Right.
projects, like you know what I
Yeah.
mean? And so, just being able to, be there for that is important for
Right.
me.
Yeah. I
To
mean,
show
shoot.
like you need to go into the communities and talk to people. It's a lot of smart, bright people. I'm not a anomaly. It's a million other
Mhm.
me's that just need the
It is.
opportunity, that just need to, so that's why I exist to say, and that's why I like to show videos, pictures of myself, like with a gold tooth for where, how
Mhm.
me in West Baltimore in the 80s or the 90s, because
Mhm.
this is that. Like, don't
Yeah.
think that just because the person is that, it can't be this. You know
Right.
what I mean? Like, you use your brain, use it. It's going to come up on the test. You know what I'm saying? And so, it's like I say, it's that critical analysis, that class analysis. And I think
Mhm.
that my experience in Baltimore, it's a lot of different class related issues.
Mhm.
And so yeah, so that's one of the reasons why I like to be present, is because, yeah,
Wow.
I'm here, I'm on that.
My new tagline for the show and for the hat is "Off politics, on people," because it is supposed to be about the people. Yes, clock that T.
Yeah, okay.
That's it.
It's about the
Speaking
people I
of
love. Yeah, yeah.
speaking of, politics, I guess you have a mayoral appointment. Can you
I
tell us about that?
do. I'm so honored. My goodness. I'm
Mhm.
so grateful. I really am. I'm so honored. So I was appointed by Mayor Scott to the Trauma Informed Care Task Force
Mhm.
maybe about a month ago. I'll be sworn in next Thursday. Really excited. And so I'm
Okay.
really excited to work on the trauma informed care task force because I was a part of kind of like the policy building side of the
Mhm.
policy that created the task force. As the mom, when I was a member of the Parent Community Advisory Board for city schools, initially I was a member through, I got appointed by Disability Rights Maryland. And so PCAB works with the school board, we will work with City Hall on different policies. And so
Mhm.
we worked with now Council President Cohen's office on the Healing City Act, the Elijah Cummings Healing City Act of 2020.
Mhm.
PCAB, we were invited to the table to represent parents and families for city schools. And so we were like just a part of the Healing City building process and the policy building process. And we were a part of the first press conference where they talked about what this bill will bring. And
Mhm.
so, including the task force. So in 2020, I was at the press conference with Councilwoman Cohen, talking about this. And so I did not apply for the first iteration of the
Mhm.
task force because my kids were still young. I was busy. So but I am a trauma focused practitioner.
Okay.
Going back to my field placement at the VA, it was focused on military trauma. That was when I first started working with trauma.
Mhm.
And so to be, appointed, like I applied and went through the process and went through the legislative investigation. Honestly, that's like one of the biggest moments in my life, in my opinion, because of
Mhm.
it connects to the work that I've done. You know what I mean?
Right.
Like
In the
to
career
me,
you've built. Yes.
yes, 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 yes. And I was going through a lot of different things in my life, and this like solidified for me, along with many other things. Like, you on the right path, girl. You did the right
Okay.
thing. You made the right choice. And so, being on the task force will be working on supporting legislation that makes Baltimore a more trauma informed city throughout
Nice.
our agencies
Mhm.
legislatively. I mean, I'm not legislatively. Yeah, just through policy in our agency. So I'm really
Mhm.
excited. I'm really, really excited because a thought partner of mine that I work with frequently, that I do a lot of work and research with, he also has been appointed. And we
Excellent.
both were appointed as social work, to represent social workers in Maryland. And that's my great, great friend, Bobby Marvin Holmes.
Mhm.
Him and I do like a lot of clinical work together, a lot of advocacy work. We did the leadership team with the National Association of Black Social Workers for about 3 years, from 2020 to like 2022 or 2023. But when
Mhm.
we just have a lot of history of working together. So I think that that's like a real full circle moment for both of us in the social work field. And as elder millennials, we both are 43.
Okay. Yeah.
Yeah, so I think it because it's like, you feel like, Dad, you seeing the rewards of the work, like it's been
Mhm.
so many years. You know what I
Yes. Yeah.
mean? It's been
And
so
you
many
say you're the
years.
elder millennials. You're the elder
We
millennials, but
are.
you're the I mean, now I said like we're the adults in the room. And so now
Yes.
like this is the time where we actually get to actualize like all of the things that we believe in and the values to actually move the country and the world forward. So like I don't know if you were like me, like
Yes.
as a child, I always wanted to change the world. So it's like
Yes.
now this is the time. I have the wisdom, I have the information, I have the attitude. So this is the time. There's some way to make an impact, and now is the time.
Yes. And that is the same way I feel. So I'm excited about
Yeah.
this new season.
Yes. Well, thank you so much, Jessica. Is there anything else you'd like to tell us about?
So I do have a new book that is coming out. So I'm also an author. You can look
Mhm.
me up on jessicafauntleroy.com. And on there, you basically can learn just like everything about what I do. I guess I would call myself a multi hyphenate. Like, so I am
Mhm.
a clinical social worker, but like I'm a multi hyphenate. I do a lot of different things. And so you can learn about those things on my website.
I love that. I need to get my website together. But thank you so
Look,
much, Jessica.
Fiverr.
I am a person who, for whatever strange reason, I will work with AI, but I feel like no, you need to figure this out. I want to code everything. I want to do everything, but
I
it's
mean,
slowing me down. So you're
Fiverr.
right. No, I agree.
Well, I paid somebody. Yeah, so I paid a person. Like, so I had the basic design and what I wanted to see
Mm,
and what I wanted my message to convey, and then they
yeah,
put it together. But we can talk about that offline. But thank you
we
so much for
definitely.
having me. I'm excited. I'm so
Yes.
excited I got to be on with the Charm City Maven.
Yes, yes. All right. Well, we will talk to you soon, Jessica, and Jessica, thank you so much.
Alrighty.